Good evening. My name is Janice June, and my persuasive speech topic is on the topic of vaccinations. I ask you to take a moment and picture a young mother who is with her newborn child in an ICU and is currently on life support. She has a breathing machine helping her to continue to breathe. She's on a heart and lung machine that continues to help maintain her blood pressure and continue the support of her heart. This baby is on these machines and has gotten here because she currently has been diagnosed with pertussis. Pertussis is something that is vaccinated against and is a preventable disease. As this mother sits here holding her baby's child, praying for a miracle, she asks herself, what could I have done to prevent this? The mother reflects back on her OBGYN appointments. She was offered a Tdap vaccination and had declined it because of the concerns of getting vaccinations and autism and the risk to her unborn child. At the time of her delivery, she then had a cough. The doctors had picked up on this, and they had offered her the Tdap vaccination, which she then had received the vaccination. By then, the baby was already exposed. Into the first couple of days of her baby being home, she noticed the baby had also picked up on this cough and was having difficulty breathing. She brings the baby into the emergency room, and the baby is given breathing treatments and requires oxygen. As the baby progressively gets worse, she's admitted to the ICU and deteriorates from there. This baby unfortunately lost her life as the mom had to withdraw the baby from life support. This is actually a true story and is stories that happen throughout the year in our country, and it is something that can be preventable. Vaccinations can save lives and help prevent against disease. Vaccinations actually contain an antigen that helps, when given to a patient, to stimulate the antibodies and stimulate the white blood cells to help fight against it, which helps them to prevent and protect them from these diseases because they then form the antibodies against them. Many diseases that have either injured or killed thousands of children in the past have been eliminated due to the progression of these vaccinations. Two examples of this are the polio vaccination and the smallpox vaccination. The polio disease is something that we've really only read about in books for people of young adult age. This has been prevented because of this vaccination, and the polio disease is something that has either killed children in the past or severely crippled them. The smallpox vaccination or the smallpox disease no longer exists because of the vaccination and has been progressively passed out worldwide. There are reasons why people should receive vaccinations. One of these first reasons are vaccinations are actually safe. Years and years of scientific research and testing have gone into the progression of these vaccinations, and they have been tested significantly before going out onto the market. They have been reviewed by scientific individuals, they have been reviewed by doctors and also health professionals. It is true that vaccinations can be painful. They are painful at the injection site, and they do also hurt when going in. Many of you probably realize that when getting your flu shots this year. But when you look at the possible side effects from that, of possibly a fever and pain at the injection site, versus what progression could happen if not receiving these vaccinations, and what children go through if they actually do acquire these diseases, this small amount of pain and short-term pain is definitely worth it. There have been many claims recently that vaccinations can cause autism, and this is something that has hit the media significantly over the past several years as the rise of autism occurs. There is actually no scientific proof that shows that vaccinations can cause autism, and this is backed up by the American Academy of Pediatrics, the National Institute of Health, and the Center for Disease Control. Another reason to vaccinate is immunizations can protect those around you. Many children cannot receive vaccinations on their scheduled times due to becoming immunocompromised due to other diseases, such as heart disease. This is a specific population that I work with, and we have to hold off on their vaccinations because of heart surgeries. We need to get them back on their feet and doing well before they can receive their vaccinations because they are immunocompromised. A way that family members and caregivers can help with that is they can become vaccinated and have their vaccinations up to date. So that way they do not introduce anything into the home that can therefore continue to injure the child. In 2012, over 48,000 cases of pertussis were reported to the Center of Disease Control. And between the years of 2000 and 2012, there were 225 deaths that had occurred because of the pertussis disease. And unfortunately, 221 of those deaths were babies who were unvaccinated at the time and had actually acquired the disease from a family member or a caregiver who was positive for pertussis at the time. Another reason for vaccinating is immunizations can actually save families time and money. When a child is sick, the caregiver or the parent has to take time off of work to care for that child, which becomes lost wages. They are continuing to pay for childcare, and that child is missing school at the time. And this is time they don't get back. Finances can continue to build as medical bills continue to build up if the child is hospitalized or they're seen with frequent doctor appointments and copays. Another reason to vaccinate is immunizations protect future generations. As I mentioned before, diseases have been greatly reduced, therefore also wiped out because people have been vaccinated. Many diseases that we vaccinate against are no longer exist. And future generations can trust that they will not be exposed to these diseases because our previous generations have been vaccinated against. Here in Southern California, this is such a melting pot of people. Not only are we protecting ourselves, but we also have many people who come in from third world countries who may have not been vaccinated against such diseases such as measles or mumps. And when they bring these diseases into the country, a benefit to our children and to ourselves is that we have already been vaccinated against. So that way, when we are exposed to them, we therefore cannot get the disease. It is our responsibility as parents, as future caregivers, and health professionals to continue to educate the public on the importance of receiving vaccinations. One thing a statistic that I found recently, which I thought was very pertinent to this information, was the flu vaccination. While it is required of many healthcare professionals, it is something that is not required of children to receive during school. This year, as you can see, many people here have had cases of the flu. And the CDC reports that 95% of those flu cases are actually due to the swine flu, which is also known as the H1N1 virus. This virus came predominantly known in 2009 when it struck many individuals throughout the U.S. People who have received the flu vaccination have actually received guardianship against this vaccination. And the CDC reports that it is a very tight match against this swine flu that is hit this year. The swine flu has actually particularly affected young adults here throughout the country. And this is something that would be important to us and also to our coworkers, to our friends, to our family members. It is not too late to get your flu vaccination or to encourage others to get it, especially the elderly, people who are working in areas where they may be exposed to the public who have been carrying the flu. So this is something that we want to continue to push and realize that the risks definitely outweigh, the benefits definitely outweigh the risks to continually receiving these diseases. Thank you.